Thanks, Jamie. So up next, we have a panel discussion facilitated by Lyzz Davis of REL Midwest, and including Heather Boughton and Melissa Weber-Mayrer.
Hi, everyone. Yeah, so thanks for being here. I do not have control of the slides, so I'm just gonna go ahead and ask. Oh, there we go. Thank you. So I'm gonna turn things over to Heather or Melissa to talk a little bit about the Striving Readers Grant.
Oh, great. Yes. So Ohio, we were lucky enough to secure one of the Striving Readers grants this past October. And just about a month ago, we awarded 46 sub-grant awards. And this also includes 12 consortia who represent 112 districts within our state. And the grant breakdown is it's a preschool through grade 12 grant. And so part of the requirement was that the districts and LEAs and early childhood entities applying had to identify evidence-based practices based on what their data was telling them. And so they were searching for evidence-based practices from birth all the way to high school on how to raise literacy achievement. So our grant breakdown looks like this, represented on the screen here. We had 20 birth to age 5, 23 K to grade 5, 28 middle school, 26 high school, and it doesn't quite add up to the number at the top because a lot of our grants spanned birth through grade 12 or birth through grade 5 or K through 8. And we had a lot of discussions around how you look at your data first and to identify what is needed, and then how you would identify those evidence-based practices based on what your data is telling you.
Okay, so next slide, please.
So I kind of already said these things here.
Right, right.
What we did find was that this required a lot of hand-holding and a lot of explanation of different vocabulary terms, especially when we think about tiers of evidence. Most of our districts are used to using the word tiers as far as tiers of instruction, and so they kept getting confused by tiers of instruction versus tiers of evidence when considering the evidence-based practices that they had to provide.
Right, okay, so next slide, please. So in December, then REL Midwest, myself and David English, we led kind of a 2-session crash course on evidence-based interventions for the ODC staff working on this project. And the first session provided an overview of the 4 levels of evidence defined by ESSA, which are strong, moderate, promising, and demonstrates the rationale. And I apologize if there's background noise because I'm in an airport right now, but I'll mute when I'm not talking. So we applied the criteria that ESSA uses to determine the levels of evidence to the standards of existing research clearinghouses. Specifically, and the one that we kept had the most focus on was the What Works clearinghouse, but there were other similar clearinghouses to basically to determine their intervention's level of effectiveness. Next slide, please. So the coaching sessions resulted in a crosswalk tool that allows practitioners and policymakers to determine the ESSA tier of evidence achieved by a specific intervention and outcome if it meets a particular clearinghouse evidence standard, which for What Works clearinghouses meets standards with or without reservation. Next slide, please. And then we use that crosswalk as a framework for several resources that we developed for Ohio districts that were applying for these Striving Readers subgrants. The first was 2 workshop presentations that help the district understand the districts understand the ESSA tiers of evidence and how to navigate the What Works clearinghouse to either find interventions that meet their needs or to verify what evidence tier a specific intervention falls under if they have one in mind and they want to propose it in their application. Next slide. So we also developed 2 step-by-step guides for districts. These really laid out the specific steps that you need to align interventions and their outcomes listed on the What Works clearinghouse to the ESSA evidence tiers. We developed guides for the Find What Works searchable database as well as for the What Works clearinghouse practice guides. And the materials we developed really have been in pretty high demand. Several other states, especially other striving readers states, have requested the materials. So because the demand for these resources, we're developing them for a broader audience, and they should be available on the REL Midwest website in the next couple of months or so. So that all I have, and I think we're going to turn it over to a panel discussion.
Then where are you? You can share mine. I don't know.
Okay. So I have Heather and Melissa on with me, and a question for them is, first of all, how have the coaching sessions and materials helped Ohio districts in their use of evidence, and what worked about this approach? In other words, in what ways did it help overcome common challenges in evidence use?
Thank you, Liz. First of all, good afternoon, everyone. Really very happy to be joining everyone on this panel, and thank you to the previous presenters for sharing such helpful information. So as Liz said, she came to us with David in December to kind of kick off the work that we were doing around understanding the evidence-based requirements in ESSA. And although the question that Liz asked is around how did the resources they developed for us help our districts, I should note that in fact, part of the reason we reached out to the REL initially was because we as a state really felt the need to better understand the definitions of evidence-based strategies as laid out in ESSA. So we know that the concept of using evidence-based strategies is not particularly new, but the specific definitions laid out in ESSA are fairly new, and they raise the bar around using evidence-based strategies. So we really wanted to have a firm understanding of those definitions and the implications of the different tiers. And as a state, because how can we provide support for our districts and address their questions if we ourselves don't fully grasp what we're working with? So Liz and David came in and helped us start thinking about the definitions, their meaning, their implications for policy and practice within districts. And as we were doing this and we started thinking about existing clearinghouses, we started to recognize that all of us at the state and district level would really benefit from some additional resources to kind of help translate existing clearinghouses. And part of the reason that this was particularly important for Ohio was because through ESSA, we've committed to developing an Ohio evidence-based clearinghouse to support our districts. And the intention here is not for us to recreate the wheel. We know that there's a lot of really wonderful existing information out there in the existing clearinghouses. What we needed was some help in figuring out how to make the best use of that. And we did not want our districts to have to go out there and figure that out on a one-off basis, each one of them trying to figure this out on their own. Rather, the work that the REL did for us helped us put together sort of common language, common understanding of definitions, and start to develop these step-by-step guides that we could then provide to our districts to say, you know, we're not asking you to go out there and do this on your own. Here's some guidance and a starting point for you. So we've been referring to our initiative here around evidence-based strategies as empowered by evidence. We want to empower all our districts to be able to go out there and take advantage of the research that can support their work. And so the resources that the REL developed for us are one step in that direction. So Melissa, would you like to add anything to that?
Sure, I'll add just a bit, because I was thinking about when Jamie was talking about who is your audience, and Heather mentioned a little bit about that, and that our audience actually includes our state level staff, and then we have regional arms that work directly with the districts, who would be our state support teams and our educational service centers, and then our local districts. And so when we think about our audience around evidence-based, what they really liked was the crosswalk, as Liz said, and other states are asking for that. And we were kind of moved into high gear because of the Striving Readers grant and our timeline for that grant application in order to provide some sort of assistance on how to identify these evidence-based. And interestingly enough, it's a literacy grant, and people got hung up on vocabulary. So, and defining these vocabulary terms, such as tiers, as I mentioned before, tiers of instruction or tiers of evidence, and understanding that, how that word works in different contexts. And then our other trip-up word was the word intervention, because as a practitioner listening to the language, they immediately went to intervention as far as instruction, and not intervention as far as an intervention as a research piece. So we had some defining of terms to do, both at the state, well, all three, at the state, the regional, and the local levels, and we're still continuing to do that to the point where we will not have people in tiers, the ones that fall down your face, which we had, because they were frustrated and trying to remember all of this, knowing they had a timeline that they were committed to submit a Striving Readers grant, and they were worried that they would be dinged if they did not identify evidence-based practices correctly. So having said that, they were not, but now that we're going through and reading grants, what we're noticing is that they have identified strategies that do have evidence-based behind them, but now we're finding that we have had several of our awardees who have identified the same strategy. However, they've identified it as a different tier of evidence. So for example, let's say 5 of them identified vocabulary for K through 5 as their evidence-based strategy. One person said it was tier 1, one person said it was tier 2, one person said it was tier 3, and 2 said it was tier 4. So we're trying to help navigate those waters, because what we want to be able to do as they move forward is to have them feel confident in identifying these evidence-based strategies correctly.
And one more thing I would add to this is that the other benefit of having these definitions outlined the way they have been outlined, and the crosswalks to the clearinghouses, is that it helps, I believe, that both the districts and the state know what to ask for as we're engaging with research partners or working with vendors. It hopefully will give folks the information that they need to be asking the right questions around what's working, or what the evidence is that something may work, or if they're developing a research project with someone, this will give them the ability to ask the right questions, knowing that they need to be using evidence-based strategies for various purposes. What's the research project that is going to get them there?
Excellent. Thank you so much for that information. I think you really did a great job talking about that process. I remember it fondly. I really loved working with these ladies. So I actually need to turn things back to our moderator, and we're going to, I guess, take questions from our audience.